Hi, I'm Dr. Jeffrey Rejuvenation from the IPL Cosmetic Surgery and Laser Center in San Ramon, California. And today's show is going to be on stem cell facial rejuvenation. And this is a really exciting new area which combines both laser technology and the latest in processing fat to remove the stem cells. So the way that this process works is we have a patient, for example, who has wrinkling and fine lines, brown spots, pretty much any facial abnormalities in terms of things that occur with aging, sun damage, etc. And we want to give the patient the best possible in terms of improvement to make the face look more youthful and to make them years and years younger looking if possible. So in the past we've had things like IPL or Fotofacial, we've had CO2 resurfacing, then along came fractional resurfacing. But now there's a new technology which can actually be combined with the laser technologies to add that much more of an improvement to the face. And as I say, this is called stem cell facial rejuvenation. And it all starts here. It all starts with, believe it or not, with fat. Turns out that fat is a fantastic source of stem cells. It contains millions of stem cells per cubic millimeter. And stem cells are what we call multipotent. They can actually repair and maintain tissue that they're around, and depending on what tissue that they're placed in or what tissue they're in, they actually can help repair and maintain that tissue. So when we're talking about the skin, we're talking really primarily about aging. And what happens with aging? So let's think a little bit about the process of aging. Well, there are really three parts of aging. There's surface aging, which is fine lines, irregular pigment, thinning of the skin, pore size, and so on. There is then sagging, which is sort of the drooping of the skin, and then there's sinking. Well, stem cell facial rejuvenation treats primarily the first part of this aging process that I talked about, which is the superficial aging. And so this is how it works. We take fat from someone, typically via a process called liposuction or liposculpting. And fortunately, most of us have plenty of that. Americans have more than their fair share. So we have plenty to go around to produce enough of the stem cells that we're looking for. But anyway, what we do is we first take fat and we remove the fat via a process called Tickle Lipo, which is a rapidly vibrating cannula, which actually goes into the fat through a little tiny incision in the area we're taking it from, typically the abdomen or the sides, although we can use the hips or we can use the inner or outer thigh or other areas of the body. And we remove a little tiny bit of fat from the body, usually about 100 cc's. We then take this fat and we process out the stem cells, all done in a very sterile technique, and remove the stem cells through a fairly simple process. Now these stem cells are then ready to go, except they're now in sort of a pellet form or almost a solid form. So the next step is we remove blood from the patient, and just as if we're doing a regular blood draw on someone. And with a special kit, we take and make what's called PRP, or platelet-rich plasma. Platelet-rich plasma is a combination of platelets and growth factor. We then take that platelet-rich plasma and we mix it in with the stem cell so that we've removed from the fat to make sort of a serum. Now this serum is ready to go, and this serum is it's the combination of the stem cells and these growth factors and platelets, which actually help to activate the stem cells. The next step is we use one of our modern laser technologies, and it can be either fractional CO2 or in most cases it's the Fraxel. And this is the tip from the Fraxel technology, and what Fraxel is it's a device that puts millions of tiny holes into the skin, microscopic holes. So the laser will come through this piece, and then we actually roll back and forth on the skin like this, in order, typically on the face in this case though, in order to create those tiny little holes. Now there's an opening into the skin, and this is perfect because we can actually just simply paint on the combination stem cell PRP mixture and allow it to settle into the skin, and the skin actually once it's been opened like that, it'll absorb things very easily and absorbs the mixture right into the skin. So one gets a combination of effects here. It's really an exciting achievement in terms of the work that's been done to bring this technology to us. The exciting technique that occurs is that the stem cells, once they're in there, help to rejuvenate the skin in a very effective way. And the PRP, or platelet-rich plasma, also does the same thing. There's a technique called the vampire facelift, which is simply the PRP placed on the skin along with the laser technology. But in this case, we've gone one step further and we've actually mixed the stem cells in there as well. So what you see over time is you see an excellent rejuvenation of the skin. You see smoothing of the skin, you see reduction in brown spots and pigmentation, you actually see a little bit of tightening of the skin. And much of this comes from the laser technology, but it's also enhanced by the stem cell PRP mixture. So let me talk about a particular patient just to give you an example. Mary's a 55-year-old female, and she came into me with some wrinkles around the eyes, some pore size that was enlarged. She had a lot of superficial aging. She really never had anything done to her skin in terms of the technologies. So she had brown pigmentation, she had some red spots, and as I say, her pore size was a little bit enlarged as well, and she was beginning to sag in some areas and sink in some areas. So we took her through this process, and just a one-time procedure, removed the fat from her via about a 30-minute process using the Tickle Lipo, took the fat through the process to remove the stem cells. We drew her blood, made the PRP as I mentioned, mixed the two together, the stem cells and the PRP to create a mixture that was ready to go as a serum. We then did the Fraxel 1550, which is the deeper Fraxel on her face, and then we applied the stem cell mixture to the face, just essentially painting it on. And waited for about 15 minutes, allowed it to soak in, and then she was done. She was ready to go. This was all done under local. She didn't need any additional sedation or any additional even pain medication to get through the process. Well, we saw her back at about 1 month, and what we could see was a significant reduction in brown pigmentation, a significant reduction in fine lines. She had just a much more glowing appearance to her skin, which was made possible partly, as I say, by the fractional resurfacing technique that we used, but also in addition the PRP stem cell mix. Then at about 6 months we saw her back for a final check, and at that point we saw some significant tightening in the skin. Her brown spots were completely gone. The fine lines had virtually vanished around her eyes. She also had some little tiny lip lines above her lip, visible only if you look closely, but those were completely gone. And her skin overall had a much more youthful glow to it. So this is something which really takes us a long way in terms of improving our abilities to work with patients, and it's amazing the distance we've come in just the last 10 years in terms of the new technologies and how we can actually combine technologies nowadays to get an even enhanced result. It's rare that we ever use a single technology on a patient anymore and just say, okay, that's it, you're done. By combining technologies as we've done in this particular instance, we can actually enhance the result in a multiplicative way. So again, that's the stem cell rejuvenation for the face, and if you'd like further information, please feel free to look at our website at www.IPLCosmetic.com or call us at our office in San Ramon, California at 925-275-9333. And thanks for listening today.